Hi everybody, it's Tamara here. Just sharing a short video today about what we can do when we don't know what to do. And in the body and mind training approach, there's many things that we can do in this exact moment. And what's great about these tools and techniques is that they don't really require anything fancy. They don't require any technology even. They just use you, your mind, and your body. So I've been working a lot over the last weeks and months helping people manage some very distressing mental states and experiences. And my top tip in these moments is a practice where you take your hand and you place it on your chest and over your heart. Now, it sounds very simple. It sounds perhaps like this would be a strange or an odd thing to do, but I'm going to tell you a little bit about some of the science that underpins this very simple and effective practice. So first of all, you are making a gesture of care to yourself, which is taking your hand and supporting yourself by placing your hand on your chest. And from an embodied cognition point of view, this initial movement is already doing something to signal to your brain and signal to your mind that you have the intention to care. Secondly, you're using your hand, which from our brain-wise perspective is a really smart thing to do because there's huge parts of your brain that are dedicated to processing information from your hand. So if you use the hand as the focus of your attention, it's very rich. It has a lot of data in your brain being fed into your brain moment by moment. And this makes it a little bit easier to hold the attention on that object. Now, when you make that movement, placing the hand on the heart, you've got a whole variety of sensations to tune into. This could be the sensation of pressure, of contact, of warmth or coolness, the textures of the clothes that you're wearing. And what we know is that for real power is to put the hand directly against the skin, what we call skin-to-skin contact. This is how you would soothe a baby. When a baby's skin touches the skin of a mother or the parent, this is a core part of what activates the soothing system. Now, if you want to go deeper with this, you can take your mind internally into the body to tune into the sensations of the heart, whether this is the physical sensation of the beating heart or the more subtle sensations of the energetic heart. There's such a variety of sensation that we can tune into there. But when we do this, we're regulating our vagal nerve. We're asking the system to calm down. We're activating the soothing system, what we call get into the green. Now, when I first started this exercise, I was a little bit skeptical about it. I have a brain that's really addicted to complexity and sensation. So for me, it was a little bit odd to start doing this practice. But I gave it a go and I listened to a few audios initially to help me, to really help my mind to train how to do this practice. But with time and with practice, it's now one of my go-to things to do when I notice that my heart is beating or my mind is racing or I'm getting a sense of becoming a bit ungrounded. This is really a rapid way to help you tune back into your body, connect to your heart, and regulate the system. Now, I've been using this technique with many of my clients, some of whom are really experiencing distressed and dissociative states of mind. So I know that this really, really works, even in the most extreme cases. And this is also a practice that I teach to those working in healthcare, because we know as health professionals, when we're dealing with other individuals who are highly aroused, whose threat systems are highly activated, this impacts on us. And our job in this moment is to regulate our own vagal nerve, our own system, in order that we can be present and open and contain the other person's distress. So this is a practice. It's not just for those in distress, it's for the healthcare workers, it's for the patients that they see. It really is for everybody. I use it in moments of stress. I use it in moments of calm to just practice and get my brain used to it. I use it at night to help me get to sleep. I use it at night when I wake up and perhaps notice that some anxiety is creeping into the system. The heartbeat is starting to elevate. I put my hand on my heart. I take my attention to the hand on the heart, take a few deep breaths. And with practice, this gesture and the effects of this gesture get more and more intense the more you do it. So if you start it off and it doesn't really feel like anything's happening, keep going, because after a while it will become a new type of conditioned response, which is one to calm you and soothe you. And in the madness that is our modern life right now, we need all the help we can get. So I'm going to paste under this video a link to a hand-on-heart practice, and I wish you the opportunity to explore this for yourself, and I hope you find it useful. Take care.